Diclofenac, also known as Zorvolex, is a medication used to relieve mild to moderate pain and swelling from conditions such as headache, dental pain, menstrual cramps, and muscle aches. It can also reduce pain, swelling, and joint stiffness from arthritis. This helps you to do more of your normal daily activities. It is a nonsteroidal anti-inflammatory drug, NSAID, that works by blocking your body's production of certain natural substances that cause inflammation. This effect helps to decrease swelling, pain, or fever. If you are treating a chronic condition such as arthritis, consult your doctor about non-drug treatments and/or using other medications to treat your pain. The daily dosage and optimal timing of Zorvolex should be determined by your doctor based on your specific condition. Before taking Zorvolex, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth as directed by your doctor, usually 2 to 4 times a day with a full glass of water. Do not lie down for at least 10 minutes after taking this medication. If you experience stomach upset, take it with food, milk, or an antacid. The dosage is based on your medical condition, response to treatment, and other medications you may be taking. To reduce your risk of stomach bleeding and other side effects, take this medication at the lowest effective dose for the shortest possible time. For certain conditions, such as arthritis, it may take up to 2 weeks of taking this drug regularly until you get the full benefit. If you are taking Zorvolex as needed, remember that pain medications work best if they are used as the first signs of pain occur. If you wait until the pain has worsened, the medicine may not work as well. Remember to tell your doctor if your condition gets worse. Some common side effects of Zorvolex may include upset stomach, nausea, heartburn, diarrhea, constipation, gas, headache, drowsiness, dizziness, or blurred vision. If any of these effects persist or worsen, inform your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. Zorvolex may also increase your blood pressure, so it's essential to monitor your blood pressure regularly and inform your doctor if the results are high. Be sure to contact your doctor immediately if you experience any serious side effects, such as changes in hearing, mental/mood changes, easy bleeding/bruising, difficulty swallowing, or symptoms of heart failure. Seek medical help right away if you experience signs of kidney problems or symptoms of liver damage, as these can be very serious. While a serious allergic reaction to Zorvolex is rare, it's important to seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as fever, swollen lymph nodes, rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. In the U.S., you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report any side effects to Health Canada at 1-866-234-2345. Taking Zorvolex, a nonsteroidal anti-inflammatory drug, may rarely increase the risk of a heart attack or stroke, especially if taken for a long time. This risk may be greater for older adults or those with heart disease, high blood pressure, diabetes, or a family history of heart disease. It's important not to take Zorvolex right before or after heart bypass surgery. Another rare but serious side effect of taking Zorvolex is the possibility of serious bleeding from the stomach or intestines, especially for older adults. If you experience stomach/abdominal pain, black/tarry stools, vomit that looks like coffee grounds, chest/jaw/left arm pain, shortness of breath, unusual sweating, confusion, weakness on one side of the body, trouble speaking, or sudden vision changes while taking Zorvolex, seek medical help right away. It's important to talk to your doctor or pharmacist about the benefits and risks of taking Zorvolex, and to follow the recommended dosage and timing for this medication. Before taking Zorvolex, it's important to discuss any allergies with your doctor or pharmacist, as this medication may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history, especially if you have asthma, blood disorders, heart disease, high blood pressure, liver disease, or stomach/intestinal/esophagus problems. It's important to drink plenty of fluids while taking Zorvolex to prevent dehydration, especially if you are older, have heart failure or kidney disease, or take certain medications. Be sure to notify your doctor if you experience pink/bloody urine or any unusual changes in the amount of urine. Zorvolex may cause dizziness, drowsiness, or blurred vision, and alcohol or marijuana use can worsen these effects. It's important to avoid driving, using machinery, or anything that requires alertness or clear vision. Limiting alcoholic beverages and discussing marijuana use with your doctor is also recommended. This medication may increase sensitivity to the sun, so it's important to limit time in the sun, avoid tanning booths and sun lamps, and use sunscreen and protective clothing when outdoors. It's also important to discuss the use of Zorvolex with your doctor before having surgery or dental procedures. Older adults may be at greater risk for certain side effects while using Zorvolex, including stomach/intestinal bleeding, kidney problems, heart attack, and stroke. Women of childbearing age should discuss the benefits and risks of using Zorvolex with their doctor, and should notify their doctor if they are pregnant or planning to become pregnant. This medication may harm an unborn baby and cause problems with normal labor/delivery, so it is not recommended for use after 20 weeks of pregnancy. If use is necessary between 20 and 30 weeks of pregnancy, the lowest effective dose for the shortest possible time should be used. It's also important to consult your doctor before breastfeeding while using Zorvolex. It's important to be aware of potential drug interactions with Zorvolex, as they could change how the medication works or increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Zorvolex include aliskiren, ACE inhibitors, angiotensin II receptor blockers, citalopram, corticosteroids, lithium, methotrexate, and water pills, diuretics. This medication may also increase the risk of bleeding when taken with other drugs that also may cause bleeding, such as antiplatelet drugs and blood thinners. Be sure to check all prescription and non-prescription medicine labels carefully, as many medications contain pain relievers/fever reducers that are similar to Diclofenac and may increase your risk of side effects if taken together. If your doctor has directed you to take low-dose aspirin to prevent heart attack or stroke, you should continue taking it unless instructed otherwise. If someone has taken too much Zorvolex and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of an overdose may include severe stomach pain, slow or shallow breathing, and extreme drowsiness. It's important to seek help right away if you or someone else has taken too much Zorvolex. It's important not to share Zorvolex with others. Your doctor may also request lab or medical tests, such as a complete blood count, liver/kidney function, or blood pressure tests while you are using this medication. It's important to keep all medical and lab appointments and consult your doctor for more details. In addition to taking Zorvolex, lifestyle changes such as weight loss if needed, and strengthening/conditioning exercises may help improve your flexibility and joint function. It's best to consult your doctor for specific instructions on how to incorporate these changes into your routine. If Zorvolex is prescribed to you on a regular schedule and you happen to miss a dose, take it as soon as you remember. But if it's close to the time for your next dose, then just skip the missed one and continue with your regular schedule. Don't take a double dose to make up for the missed one. The usual dosage of Zorvolex is 35 mg 3 times daily. It's best to take it with food to reduce the risk of stomach upset. And remember to take it at the same times each day to get the most benefit from it. When it comes to storing Zorvolex, it's best to keep it at room temperature in a tightly closed container, away from light and moisture. Avoid storing it in the bathroom, and always keep it out of reach of children and pets. When it comes to disposing of Zorvolex, never flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. If you're unsure about how to dispose of it, consult your pharmacist or local waste disposal company for guidance. Remember, it's important to handle and store medications responsibly to ensure their effectiveness and safety. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.